Hey guys, it's Rena Jadov here with Health Boot Camps and Dr. Jolene Brighten with her amazing book, Beyond the Pill. Now, today we are going to tell you how you're being deceived, what you don't know, and your doctor isn't telling you about the pill. Dr. Jolene, tell us, what is it that we don't know and we really should know?
So number one is the pill cannot and does not balance your hormones or fix your period. And I think that we can all understand that if you're taking a medication that shuts down how your brain communicates to your ovaries and how your entire reproductive system works, it cannot actually be balancing that system in any way because it is in fact suppressing it. And so if you're getting on the pill because of painful periods, heavy periods, because you're experiencing acne, please understand that the pill is not a root cause solution to that. And in fact, if you are a woman who is struggling with any of those things, I've got a few tips for you. One is you can start to incorporate omega-3 fatty acids into your diet. They're anti-inflammatory, they help with menstrual cramps, and they will improve the oil production in your skin. You can also begin a magnesium supplement. Magnesium has been shown to help with headaches, to help with menstrual cramps. In fact, it can help with cramps throughout the entire body, and it's essential to your hormonal health. And then, of course, you can start incorporating leafy green vegetables into your diet, which is going to give you not only the fiber that you need to move your estrogen out of your body to start to optimize your hormones, but the nutrients you need to have amazing hair, skin, and nails, to have optimal hormones, and to feel your best.
Oh, fantastic. Okay, what's number two?
So if you are experiencing chronic gut infections, like you keep treating SIBO, you keep treating Candida, or you just keep mounting more and more food sensitivities, it may very well be that the birth control is at the root cause of that. And the reason is because hormonal birth control disrupts your microbiome. So your good gut bugs in your gut, they get skewed, and it leads to intestinal hyperpermeability, which means leaky gut. And that is how food sensitivities develop. So it may very well be that if your doctor is treating your gut infections over and over or telling you to eat less and less foods, that they're missing a big piece of the puzzle, which is the pill.
And that was me. I got on the pill because I had ovarian cysts that burst, and for 5 years after, I developed every known gut problem to mankind, from dysbiosis to Candida to leaky gut to eventually SIBO. So living example number one, I got off the pill, and of course I began my healing journey. Okay, what is number three?
So number three is the pill might actually make your acne worse. So some women do get on, I know, right? So some women get on the pill and they see that their skin starts to clear. Other women, it gets worse. But I've also seen that your skin clears and then progressively it gets a whole lot worse. And when you come off, there's a phenomenon that I explain in my book, Beyond the Pill, called the androgen rebound, where now your testosterone comes back online, which makes your skin oily and your face break out. But we also have to recognize that hormonal birth control depletes nutrients, and namely zinc. And zinc keeps our testosterone in check, it helps our immune system, and it's a crucial player in your skin health. So keep this in mind. If you're using hormonal birth control to manage your skin symptoms, it's a temporary solution that may over time actually make your skin symptoms worse.
And there are so many better ways to get rid of that acne that you have, which we'll talk about in a different video. All right, number four.
Number four is the pill may just be the reason you keep having those bad boyfriends. So real talk here. It's been shown in studies that women who are on hormonal birth control actually select mates that are more genetically identical to themselves. So yeah, the pill might make you attracted to someone that on the genetic level is a lot more like your cousin. And this
yuck.
So this is a really big problem because we select our mates based on immunological expressions. You can smell this on a man. And so you are seeking out the mate who is as genetically diverse as possible. So opposite of you. And that allows baby, so you make baby together, to have a robust immune system and the most genetic variation, which is very important in baby's survival, but baby's health overall. And so if you've been on the pill, you keep finding yourself in these bad relationships, you gotta question, is the pill messing with your mate selection?
Damn, there's the reason right there to stop taking those pills. All right, number 5.
You may not be able to just get off the pill and have a baby right away. And this is a really big one because a lot of us ladies, and myself included, are told that hormonal birth control has no long-term consequences for our reproductive health. However, I have seen clinically, and there is research to show, a phenomenon called post-pill amenorrhea, the loss of menstruation and ovulation following the discontinuation of hormonal birth control. We also have to recognize that birth control is depleting your nutrients, and it's also causing changes, and we need a lot more research to understand this, but changes to the endometrial receptor, so the lining of your uterus that helps you build the endometrium. You need that to be able to maintain a pregnancy. And so I think that we need to be having an honest conversation with women that if you do want to have a baby, coming off that pill 1 to 2 years prior so that you can prepare your body, optimize your health, and make sure you undo any damage that may have been done while you're on hormonal birth control is a very important step in your reproductive health.
I wonder to what extent, and I'm sure there's going to be a lot of backlash when I say this, but I'm going to say it anyway, the extent of the children that are being born with allergies, eczema, low immunity, of course, autism spectrum. I wonder to what extent all of that is because so many women have babies they go on the pill, they get off the pill in order to get pregnant, then they get pregnant and their bodies are just not ready. As you mentioned already, so many of the things, whether it's, impact on the gut, and you're going to talk a lot more about all the other impacts. We've got a very complex machinery and we're messing with it.
Well, and I think I really want to frame it in what you're saying, that we have to be asking that question. We have to be asking, what impact has hormonal birth control had in some of the diseases that we've seen developing? Now, it's way more complex than that, but as we ask that question, we are not shaming women. We are not blaming women in any way, but we have to ask these questions so that we can get a better understanding and we can advise women on how to do better. I mean, we know just depleting folate and B12 alone has adverse effects to the neurological system. Hormonal birth control does that. And so I think it's important. I think the most anti-science thing we can do is shut down and stop asking questions. And if we don't continue to ask questions, we'll never understand how to serve women better.
All right, number 6.
So your IBS, irritable bowel syndrome symptoms, might actually be because of hormonal birth control. So we know that hormonal birth control is associated with an increased risk in Crohn's disease. And one of the ways that Crohn's disease can present before it's a full-blown expression of the disease is with loose stools and diarrhea or changeable bowels. We also know that hormonal birth control is disrupting your microbiome. So not enough of the good guys and overgrowth of the less favorable guys, and the impact it has on the small intestine and contributing to intestinal hyperpermeability may very well be the root cause of your IBS symptoms. And so it's worth questioning. It's worth having a conversation with your doctor. And when in doubt, get it checked out.
Love that. Number 7. What do we not know? And what is the doctor not telling us about the pill?
Your depression and your anxiety may be because you started hormonal birth control. Now, we are not at the place in the research to be able to say causation, but we do know there is an association and a correlation with women beginning hormonal birth control. In fact, a study of over 1 million women showed that if you started hormonal birth control, over 20% more likely to be prescribed an antidepressant.
Wow.
And we understand that hormonal birth control depletes vitamins and nutrients that we need to be able to synthesize neurotransmitters. It affects our gut, which we now understand plays a huge role in our health, and it's grabbing onto your hormones like testosterone and thyroid and causing inflammation. I mean, any one of those things alone can contribute to anxiety and depression. So if you started hormonal birth control, you're starting to have mood symptoms, I want you to grab Beyond the Pill, check it out, make sure that you get informed, and please make an appointment with your doctor to understand your root cause and the impact that birth control may be having on your mental health.
Number 8.
Oh, those chronic yeast infections. So chronic yeast infections in the vagina or in the mouth, it may very well be due to hormonal birth control. So we understand the disruption that happens all the way through the gastrointestinal tract, so that includes the mouth, but we also understand that our gut and our vagina share organisms. So if you're a woman using hormonal birth control, you're finding that you have chronic yeast infections, you are the gal that's always taking diflucan or having to go to the store to get some Monistat and things of that nature, you have to question the impact of hormonal birth control on your vaginal ecology and that pain that you may be experiencing.
And you need to go check that out with a doctor and promptly find a replacement. All right, number 9. What do we not know?
So your disinterest in sex or pain with intercourse may very well be due to hormonal birth control. And that's because hormonal birth control actually grabs onto your testosterone and other hormones that help you have a healthy libido. Now, in addition to that, we know that hormonal birth control can lead to pelvic pain, pain with intercourse, and even vaginal atrophy, which is something that we shouldn't see until our estrogen declines at a later stage in life. Yet there's women in their 20s who have reported vaginal atrophy that is thinning of the tissue. So hormonal birth control may very well be the reason you don't want to have sex anymore, or you're having pain when you have intercourse.
Yikes, here's another reason to not be on it. Who wants to have painful sex? Okay, number 10. What is our doctor not telling us that we don't know about the pill?
So the pill can and does kill. And this is the real talk. I'm not trying to scare you. I don't want you to be afraid. I want you to have the knowledge and the understanding of what to talk to your doctor about. So yes, maybe the stroke and the heart attack rate is low when we look at a whole population of women. But is that true for you? So in women that are aged 15 to 34, it's estimated that the risk of death due to a circulatory disorder, so like stroke and heart attacks, is about 1 in 12,000 when you use hormonal birth control. When you're not on hormonal birth control, that's about 1 in 50,000. So that's a big discrepancy there. And what's most important to understand is that 1 in 12,000 might sound like, oh, well, that's not a huge risk. But we are talking about stroke and heart attack. So you have to weigh, are you willing to take that risk? Now, how can you stay safe? Again, I don't want to just scare you. You can have a couple of tests done. So one is you can test yourself. You can ask your doctor for a factor V Leiden genetic test. And this is important because if you have a factor V mutation, then you take the pill and you're about 35-fold increased risk of having a stroke.
Oh, wow.
That's big, right? Women with MTHFR using hormonal contraceptives, so this is another genetic test that can help you get in the know and know your risk, they have a 5.4-fold increased risk of having a stroke. So, well, 1 in 12,000 may not sound like a lot. Based on your family history and your genetics, it may be a higher risk for you. And so that's not to scare you. That's to say, advocate for yourself, get the testing, and make sure that you understand what your risk is.
And what your body is.
Mm-hmm.
I think to a large extent, we are not trained or educated in our body. It's all, like you go back to what were we taught in middle school about our body? What were we taught in high school? It's so disconnected. It's not about your body. It's about a body. It's about some diagram. And half the time I remember most of us giggling through them. And I remember when my 13-year-old went through her class, I said, what did you learn? She said, we giggled most of the time. So
yeah, totally.
Right?
Because we're taught it should be an uncomfortable conversation. We're taught like, ooh, don't talk about your body parts. But man, why did I have to wait till medical school for someone to teach me about my body parts? Like that's not right. Like women shouldn't have to go to medical school to understand their body.
Thank you. We shouldn't. And yet if you don't go to medical school, you have so little knowledge, in fact, in how it actually works.
Mm-hmm.
And so I love that you've written this beautiful book, Beyond the Pill, and I love what you're doing in terms of, if nothing else, letting us all learn a little bit more about how our very sophisticated, very complex, very beautiful body works to keeping us happy and joyful and healthy. A lot of things which we're not anymore. So if we can figure out how it works, maybe we can all get back to a place of no more anxiety, no more depression. You know, something else you said in one of these bullets was, we know that the pill hurts the microbiome.
Mm-hmm.
Microbiome is the new frontier of all this great information. But guess what? A couple of thousand years ago, we already had very smart scientists saying, hey, your gut is the root of all disease.
Yeah.
And so when I got healthier and I kind of looked back, sort of that retrospective, I realized you have to find out where the fire is, right? If you've got a lot of symptoms,
Mm-hmm.
there's the fire, because you got to burn out the original cause. And if you're taking the pill and it's killing your microbiome, that right there could be that fire that's creating all these other issues that you've identified for us.
And do you remember the time when doctors would say, you're crazy if you're taking a probiotic, it doesn't do anything. Why would you do that? And now look how far we've come. And I say that because I think what we really need is a call for medicine to be a whole lot more humble and a whole lot more curious. We're not trying to vilify anything, but I mean, this is what's got us in so much trouble, is medicine thinking they know better than the body.
Yes.
And medicine telling us that, like, oh, what's going on? Like, that's not real, or that doesn't matter. And I laugh because there are so many things in the history of what is now considered the standard of medicine that has been proven to be wrong time and time again. And I just want to say that because I want everybody listening to understand that we need to keep asking questions. Things are going to evolve. And if you find someone, I know we talked about this in other videos, but if you find someone who is quick to dismiss or who is acting like, it's one way all the way, they're not staying curious enough. They're not going to be able to change their mind about things. And I bring up the microbiome. I mean, you talking about that, I think that's one of the most powerful things that we were taught once, that taking probiotics was crazy. Why would you ever do that? And now we see that probiotics are prescribed widely.
It's the most important thing. It's the most important field of study at this point. They're saying it's connected to everything, from brain fog to your sex life. So we're just a walking, talking trillion, microbes. And if something is hurting them, then that's a problem. Any other bonus tips? Did we miss anything?
Let's give a bonus tip right here. If you are finding that you are dragging getting out of bed, you are fatigued throughout the day, you are losing your hair, you have dry skin, or you have brain fog, then you best be questioning the pill. And that's because when you're on hormonal birth control, it raises binding proteins that can grab onto thyroid hormone. Hypothyroidism is one of the number one, so Hashimoto specifically, one of the number one autoimmune conditions affecting women. Hormonal birth control depletes the nutrients you need to make thyroid hormone. It affects the organs that you need to convert thyroid hormone to its active form, and then it binds it up and doesn't let it get on the cell. And so if you are fatigued, if you are depressed, if your hair's falling out, you're constipated, you're having any of these symptoms, please at least question the pill. There is no harm in asking the question, getting the testing done, and investigating it.
I love it. All right. Well, if you're listening or watching, you've been informed. You've been empowered with information. Go take charge of your body. Make smart decisions. Find the right doctor that will work with you with curiosity to help you be the best version of yourself and spread the word. Thank you so much.
Thank you.